Lesson 3. Hostility and violent behavior, paragraphs 3.1 through 3.7. Identify the most common precipitating factor in violent behavior. Identify method to manage violent patient when who is unarmed. Identify method to manage violent patient who is armed. Identify the use of the restraint of violent patients. 3.1 Introduction. As a medical NCO, you may encounter a situation in which you need to react promptly. For example, suppose you with your son will provide medical coverage of the rifle range. Soldier begins arguing the score over the number of the targets he hit. He suddenly points to his weapon in the direction of the other soldier begins shouting obscenities. What do you do? What do you react? Well, the questions more will be answered. This lesson. 3.2 Violent behavior. The definition: patient exhibiting violent behavior to individual whose behavior potentially has with him, himself, or others fear associated with many psychiatric patients caused by the action violent or destruction and actual number such with the patients with greatly exaggerated violent behaviors is not peculiar to any of the dangers. Diagnosis is covered. There are several precipitating factors of the violent behavior included are the following: medical illness, organic brain syndrome, and the common cause, personality disorders such as poor impulse control, true psychiatric illness, a person experienced delusions of the persecution, hearing voices. 3.3 Management: unarmed violent patient with a violent agitated patient must be controlled before attempts are made with the diagnosis with refer the patient for help. Verbal control. Verbal control should be the first attempt made. As you have the proof of the patient, talk calmly to him and avoid threatening him. Tell him who you are, where, and how you plan to help him in this scope of reorientating information. Ask him the question of the trouble to him, try to find his cause for agitation. Asking why the upset often stimulates the patient to think rationally. Additionally, these questions provide necessary information. Often verbal approach is enough to calm someone who's not in panic anxiety state. Verbal approach is usually effective with a patient who is psychotic or person who has lost contact with reality. Medical care: image of the verbal controls because violent patient has calmed down. Continue with the reassure of the patient, providing orientated information. Reinforce medical care image. For example, the patient with a rifle range. First paragraph to the left and should be told, "Good, you're looking calmer. I should check your pulse and blood pressure now." If the patient accepts this, he's agreeing to sit still and will take a while when prepare for the next step. Restraint of the patient. If you cannot control the patient verbally, he must be brought to the horizontal position of floor or ground to ensure that his safety with any other people that you're able to do this. You should have a minimum of 4 to 5 people. If you don't have the number of people to have help you, wait until you do have the number unless the patient is dangerous. Something must be done at once. When you have to decide whether to take action quickly and decisively. When the patient is on the floor, place a stretcher under him. You sheath the cuffs, restraints to maintain secure control. If necessary, give the medication to the patient, maintaining his own control. The best give the medication and cause of the violent behavior can be determined because of some of the drugs and interact badly with some illnesses. If you must administer medication, carefully follow but the necessary convey with the attitude that you believe the patient of a decent human being with struggling with control of difficult thoughts or feelings. Assure the patient that no harm will come to him or nor will he be allowed to harm anyone. Expeditious transfer should be arranged for the patient to a medical treatment facility for evaluation. Or 3.4 Management: armed violent patient. Armed violent patient can be managed with a certain measure for the taking of follow with these procedures. Leave the area quickly if possible. Warn all personnel to clear area. Notify the authorities. If you're used to believe and keep it talking along with no long silence to develop. Try such things as you can do a lot of harm if you want to. Even without a gun. You look frightened. I feel frightened. You can also say, "I'd like to help you, but I'm concerned that you might be do or something with that gun," and you can take it back. Could you please put it down? Let me hold it until we can finish talking about what is troubling you. Make no abrupt movement. The subject does not give up the weapons. May be at least willing to put it in his pocket or nearby the desk drawer. It is important to often him freaks access to the exit. This could be achieved by asking him would be feel better leaving the room or staying. Stand away from the doors to keep for the patient with the field is wrapped in concern of the patient. Behaviors may depend on your position reaction. If the patient leaves the room, alters all personnel on the police. Alert all personnel on the police. No, after the encounter, violent patient, armed or unarmed, meet the staff and tell them it was done why and give the staff the opportunity to express their feelings. 3.5 Use of restraints. When using restraints, pursuits or following situation, patient violent, patient refused medical or psychiatric facility for evaluation. Patient is hallucinating from delusion. Patient is evacuated to air. Patient has substance abuse reaction with severe alcohol withdrawal, barbiturate withdrawal. How to use the restraints. There are standard restraining devices, field expedient resistance restraints. Standard restraining devices can be found with a hospital clinic. Field expedient restraints include material commonly called the soldiers or fields, such as rifle slings, web belts, bandoliers, or cravats. If used with the first restraint, field restraining devices should be placed on the standard restraining device as soon as possible. Field restraint device should not be used with the patient over long periods of time because such devices may rub with the patient's skin, causing him to injure. Field restraint device with a double litter. Following the steps, with a double litter with the litter straps of the resistant. Place patient on the litter with a prone position, head turned with the one side with a help prevent aspiration pneumonia. Putting each patient hands along his thigh and secure each hand of the litter. Place the other litter carrying side down on top of the patient. Put the litter together with two or more litter straps. Record the and report action taken in DA form standard form 600. Include the date, time the restraints were applied, with the type of the restraints applied, with the patient's tolerance, and over the procedure. Hazard restraints include the following: damage to body tissue, damage to other parts of the body, development and proper pressure of air with the patient restrained for a long period of the time if the patient does not have frequent position changes. Damage to nerve restraints are applied with the too tightly, and if the restraints become too constricted with the after application, injury, death, to use the restraints during a fire, other occurrence. 3-6 air evacuation psychiatric patients. Force-com message all up below describe the U.S. Army psychiatric patients should be evacuated by air. Force-com message, August 1978, air evacuation psychiatric patient by helicopter. Closing. This lesson has addressed the major area consideration of management of the patient hostile violent behavior. Ability to done effectively with a violent and hostile individual can be utmost important, whether the field or in-hospital environment. Knowledge, expertise you with the handling which type of the situation can be invaluable to patient of the personnel. And to continue to the exercise. A patient exhibiting violent behavior is a potential hazard to a list of three factors which cause violent behavior in a person. With the first action taken confronted with the armed and violent patient, will not leave the area. When the first action taken with the deal with the unarmed violent patient, list three items which can be used with the field expedition restraints. List three hazards with using restraints. List two situations most excite psychiatric patient to be evacuated by air. Lesson assignment, lesson 4, substance abuse.